Hello and welcome to episode 606 of People Behind the Science. I'm Dr. Marie McNeely, and today I am excited to revisit our interview with our guest, Dr. Wakenda Tyler, originally published on July 29th of 2015. Listeners, Wakenda is a talented orthopedic surgeon who is dedicated to advancing her field of medicine through research. She has been conducting research to better understand the formation of bone and soft tissue tumors and to develop treatments to combat these forms of cancer. And in our interview, Wakenda shares more about her career, her life, and her work. So listeners, I hope you enjoy this episode of People Behind the Science.
Every day, discoveries are made that will change our understanding of the world around us. Dr. Marie McNeely is here to bring you the brilliant minds who are making these discoveries so they can share their incredible stories and take you on an amazing journey. Welcome to People Behind the Science.
Hello, everyone, and welcome to another episode of People Behind the Science. I am thrilled to be here today with Dr. Wakenda Tyler. So thank you so much for joining us today, Wakenda. How are you?
Thank you. It's my pleasure, and I'm having a good day. Thank you.
Excellent. Well, we are delighted to chat with you today and hear about your experiences. So I'm going to dive right in and introduce you to our listeners. Listeners, just a bit of background here. Wakenda is an associate professor in orthopedic oncology and metabolic bone disease and adult reconstruction at the University of Rochester Medical Center. She was awarded her MD and her M.P.H from John Hopkins University and completed residency in orthopedic surgery at the Hospital for Special Surgery. Wakenda then completed a fellowship in musculoskeletal oncology at the Memorial Sloan Kettering Cancer Center before joining the faculty at Rochester, where she is today. Now, Wakenda is with us today to tell us about her journey through life and science. So we want to get to know you today, Wakenda, both as a scientist, but also as a person. So can you start off by telling us what you like to do with your time when you're not doing science?
I've got a lot of little hobbies that I like to do. Probably anybody who knows me well knows that the top of the list is running. I'm a big runner. It's a nice way to relax and enjoy life. And I run every city I go to visit. I try to run a race in. And so especially if there's ones that raise money. So that's probably top of the list of things I do outside of science. And then snowboarding and skiing and hiking and scuba diving are all on the list. And then, of course, I like to travel to new places. So.
Very cool. Sounds very adventurous. I like it. So are you more of a marathon runner, 5K, half marathon? What's your favorite?
All of the above. My favorite is probably the half marathon, at least in this stage of my life, just because I find it's a distance that you can train for in a reasonable amount of time and still have fun and be able to relax and kind of enjoy the lull of the run a little bit. But I also do 5Ks and 10Ks, and I've done some marathons, including Boston in the past.
Oh, fantastic. Well, this sounds like a great way to spend your time when you're not doing science. And next, we do want to chat about your scientific side. So can you give us a short description of how you describe what you do to someone who's not familiar with science?
I'm an orthopedic surgical oncologist is what I usually start out by telling people. And that usually leaves a little bit of a confused look.
The blank stare. Yeah.
The blank stare. Exactly. And then I proceed to try to explain that I'm an orthopedic surgeon. So that means I'm a surgeon that specializes in bone and tendon and ligament and soft tissue and muscle. But I then subspecialize in cancer and tumors of those bones, ligaments, tendons, muscle, and soft tissue. So that's basically what I do. So I diagnose and surgically treat tumors that arise in those regions, those tissues of the body.
Very cool. Well, I'm looking forward to chatting more about your work as we go through the interview, Wakenda. But let's chat real quick about motivation. I know there's so much to get done in a day sometimes. It's helpful to have little quotes or sayings or things to carry along with you to keep you motivated. So can you share with us today one of your own favorite motivational quotes or sayings?
Oh, gosh. I guess one that I often will use is keep on keeping, which is, I forget who that comes from, but it's a nice, it's just a reminder that you're going to have days that kind of push you back, that knock you over. You feel like you've been bruised and beaten up, and you just got to remember to pull yourself up and keep pushing forward.
Fantastic little quote or saying there. So do you have a favorite thing that you like to do after one of these tough days where you've gotten beaten up a little bit? Is it go for a run to help you relax?
Going for a run helps a lot. So getting some exercise in helps a lot. Reading one of my favorite authors. I'm a big Maya Angelou fan, so often I'll pick up some of her poetry and read that. It always puts me in a good mood and puts me in a good place. So something along those lines usually helps a lot.
Fantastic. Well, wonderful to hear about what motivates you, some of the things that keep you going. But I want to know next about some of the people who've motivated you or inspired you over the years. You mentioned Maya Angelou as a very inspirational author there. Are there people in science who you've looked up to?
Well, I'm a big Albert Einstein fan. I have posters of him on my walls. I think he's adorable. But I also feel like he was an individual, brilliant, but he had his own obstacles to overcome. And he never let any of those obstacles get in his way. He always pushed forward. He always kept pushing for doing what he thought was good science. And I think that that goes a long way. So definitely Albert Einstein's a big fan of mine, historic fan of mine in science.
Well, fantastic person to look up to, I must say. Some of these big historical scientists are wonderful role models to look up to all the way throughout your career. When you're a kid, they're so exciting to think about, read about their history and things like that. But then also little bits perhaps make more sense as you go through the career and actually start experiencing things yourself.
Yeah, absolutely.
Fantastic. So can you take us back now all the way to the beginning, Wakenda, and tell us what sparked your interest in science initially?
Let's go back to junior high or maybe even 5th and 6th grade. I should say my father's a computer programmer. So there's always been a little bit of a math science spin in our home. So I always kind of gravitated towards those areas. And in school, I had a science teacher, I think in the 6th grade. And unfortunately, I can't even remember her name, but she was so energetic about science and math and the formulas and everything that went into it. And that probably was the sparking point for me. And then it probably evolved. In high schools when I really met, I think at that point in time, it was mathematicians, so some of my math professors who really sparked this interest in me and sort of came to me and said, oh, you have a knack for this. You should really continue to pursue it. And I think somebody saying that to you often turns on the light bulb that, oh, I can do this, and kind of pushed me in that direction or started moving me in that direction a bit.
It's phenomenal to hear that you had early supporters, people who were encouraging you to pursue these interests, these talents that you had. Now, I'm curious, what turned your interest towards this rather specific field of orthopedic oncology?
When I got to college and I went to a small state school, Millersville University, wonderful school, I thankfully was in the honors program and had a lot of small classes, and I had some awesome, wonderful science professors there. I didn't even know I wanted to be a doctor till at the end of my first year of college, when a biology professor there came to me and said, you have a real knack for science and math, and you really seem to work well with people and are really kind. You should think about medicine. And suddenly there was this light bulb. Oh, I can be a doctor. That's great. Mm-hmm. And then that's where the spark of getting into medical school and do that sort of stuff went from. But then the orthopedics probably didn't come until I was in medical school. I thought I was going to. I had a close friend of mine pass away, or a close family friend pass away from cancer when I was in college. And so I've always had this interest in potential cancer care. But I've also always been a bit of an athlete and a little bit of a tomboy. And so when I got to medical school and learned about orthopedics and this field where you could work with drills and hammers and figure out the dimensions of the bone and how you can put a plate on it and make that work, that became so interesting to me. And then when I realized one day through a professor who was a mentor of mine at Hopkins that I could actually do both, I could be an orthopedic surgeon and an orthopedic oncologist and meld those interests of mine, the cancer and the orthopedic side of things together, it was like a no-brainer. I was like, that's it. That's the one for me.
Well, that is such an awesome story, Wakenda. And I think that's the case for a lot of people. You don't even really know what your options are. And then when someone suggests it, you're like, wait, that's a job?
Exactly.
Well, phenomenal to hear about your story. I'm curious where this M.P.H fits in. We mentioned you have a master's in public health. Where did that fit in along your timeline, and what got you interested in looking into the public health route?
Good question, because I get asked that a lot. I got my master's in public health between my 3rd and 4th years of medical school at Hopkins. So I was finishing up my 3rd year and I actually took a year off to do my M.P.H program at Hopkins. And my interest was sparked in that because through my medical school training, as you can imagine, in Baltimore City, as medical students, we have a lot of opportunity to do some outreach. And I'd been doing a lot of outreach in the community as a tutor in some of the schools, in some of the clinics. We would hold weekend clinics. And I realized that there was a really strong need for physicians to have a better understanding of the needs from a public health standpoint rather than just from the normal science standpoint, which we obviously get a very good training in that, particularly at a school like Hopkins. But we don't always get the other side of that, which is how do these patients even get to see us? What's the obstacles from stopping them to see us? The whole broad-reaching aspect of it. So I got interested in it from medical school early on when I had these experiences in my outreach programs. And then I decided I was passionate about it, that it really mattered to me, that people's access to healthcare mattered to me. And so that's when I decided to pursue my master's in public health. Today, where does it fit into my career? My focus was actually epidemiology and biostats because I thought that that would be a better fit for orthopedics. And I use a lot of that now for some of my basic science research that I do and some of my clinical research because I do some of my own statistics and some of my basic epidemiology stuff. but I also still have a very strong interest in access to healthcare. And so I try to do some community stuff right now that hopefully will more integrate my master's in public health and my interest in public health access to healthcare, not just the orthopedic side of things.
Well, I really like how you described how this public health background has given you a big picture view of the entire medical care of a patient. I think that's critical. So very, very cool. So tell us a little bit now. We've heard about your journey and kind of how you've gotten to where you are today. Can you tell us a little bit more about what you're working on? What is one of these projects that you have ongoing right now that you are the most excited about?
Well, I guess I'll talk about to tell you what I'm most excited about is probably my basic science research, because obviously I'm a clinician. I do clinical work. I take care of patients, and that's always wonderful. But I also have another hat, which is I work in the laboratory. And in the laboratory, I'm interested in metastatic cancer to bone. Obviously, as an orthopedic surgeon, people, when they get cancer and it goes to their bone, it can be a really devastating thing, and it can be painful, and it can be difficult for families and difficult for patients. And so my interest is in blocking or preventing the growth of cancers once they try to get to bone and preventing them from growing within the bone. So that's probably my most exciting research. And we're focused on blood vessel formation in the bone and trying to prevent that from growing, because we believe that the cancer needs a blood supply to really grow. So if we can block that blood supply, potentially we could block the cancer from doing harm to the bone.
So do you focus on a particular part of the body or just in general cancer going into the bone?
Just any cancer that wants to go to bone. But I have to say my main focus over the last few years has been renal cancer that goes to bone. And that's because this is a particular type of cancer that has a high propensity to go to bone. And it happens to also have a very robust blood supply. And so it's an ideal model for studying blood vessels in cancers that spread to bone. So that's the model we've been using. So that's been my most focused interest these last few years.
Now, we mentioned that you are a physician as well as a scientist. So do you actually get to apply the things that you're doing in the lab to your practice?
Yeah, a little bit. Now, I have to say the lab is always lags pretty far behind the clinical, as you probably can imagine, because when we're working on a drug that we think might work in the lab, it's amongst mice and rats that we're working on, generally speaking.
Sure.
So we can't quite go take them to the patient quite yet. But having said that, I've watched some of these agents go from other labs that I've been either looking at their research or studying what they've been doing and watching those come to fruition. A lot of the new targeted immunotherapies, for instance, I've been watching the development of that over the last few years, and it's just amazing. And then I do have patients that walk through the door, and 5 years ago, we would have had to say to them, we don't have anything new. We have nothing good to offer you right now. And now I can say to them, there's hope. There's these new drugs. I can't promise you they're going to work, but they've worked in some patients with your types of cancer. So we've got some hope here. So that's been a real change over the last 5 or 10 years.
Well, that is so exciting to be able to have these conversations with patients and to be able to know the research side intimately as well as what's going on in present clinical care. So very, very cool. So do you struggle to balance these two sides of your professional life, the clinical work as well as the basic science work?
Absolutely. And I'm sure every physician out there that tries to do both of these has the same problem. There's always a pull in both directions, right? There's always a grant that needs to get done, a paper that needs to get written, a project or experiment that we're in the midst of that I have to be in the lab for. And so that pulls me away from the clinical side. And then on the clinical side, there is always a patient that needs my help. Always. So there's always this pull back and forth. And I find that you just have to go with the flow. There's going to be times where you cancel the clinic so that you get the research done because that needs to get done because you had a light clinic that day. And then there's times where you push the research aside for a week or two and you focus on the fact that you've got these group of patients that really need you to step it up that particular week or so. And so you just let the ebbs and flows sort of take you where it's going to take you.
Gotcha. Well, I think that is a great approach to this problem. And I think you're right. A lot of physician scientists encounter this, and it's always a struggle to get that balance in work, let alone the work-life balance. And we've talked about some of the challenges that you face, but I think there are a variety of different challenges that scientists encounter on a daily basis and throughout their careers. And we love to talk about these challenges or these points of failures, these stumbling blocks along the way, because I think there aren't a lot of venues out there that really discuss these openly. And I think it's so important for the public to understand what's going on in science, but also for future scientists to see kind of what's coming down the road for them. So can you take us back to a point now, Wakenda, in your career where you struggled with something or you had a major failure? Tell us what happened and how you got through it.
I could probably mention a lot because that's the ups and downs of healthcare and science, but I guess I'll focus on my research side of things. Probably the first time that I submitted a grant My very first few grants actually got accepted, and I was on this roll. Haha, I'm great. I get these grants. I'm awesome.
What's everyone complaining about? Yeah.
Right, exactly. What's everybody complaining about? Exactly. And then I, of course, go up for a bigger grant, an NIH grant that really has some substantial components to it, and it's a career development grant, and I got lambasted on it.
Oh, wow.
They just tore me to pieces. At least it felt that way to me. And of course, my mentor at the time said, don't take it that way. But when you're reading the reviews and it just feels so personal, even though they're not trying to make it personal, but it feels that way because this is your heart and what you love and the research you love. And they're saying to you, well, it's not good enough for us to fund it. It's just not there. And we think you need to work on this. And we didn't like your idea for this. And we didn't like your idea for that. It's their job as reviewers to do that. I get it, but boy, it hurts sometimes. And I remember the first time that happened with me, I just crawled under my blanket at home after I got the results back and cried for like an hour.
Aww.
I felt so crushed. But I went in the next day and sat down with my mentor at the time, Dr. Schwartz, who's one of our researchers here. And he had the right attitude. He's like, this happens to everyone. Every person, including me, as he said, it gets one of these bad, doesn't feel so good. You pick up the pieces and you get back to work. Don't let it slow you down. The first thing to do is drop a new project on my desk, probably purposely, so that I would have something to keep me distracted from this. And that was smart on his part, because what did I do is just get right back into the next project and keep pushing forward. And that was the right thing to do. But it certainly hurts. And I think every researcher goes through that. It feels like a personal attack, even though it's not, but it feels that way at the time.
Well, Wakenda, I think you brought up so many important points in this story. And I think a lot of our listeners are probably nodding their heads if they have gone through this experience, even as a young scientist with that first paper that you submit or something like that, where that rejection stings the first time, probably the first several times, and maybe even later on in your career, just putting everything out there, these best ideas that you have, this grant that you've poured your heart and soul into, like you said, just to have it kind of nitpicked apart by the reviewer committee, I think is a struggle every time it happens. So
yeah, that's right.
Well, thank you for sharing this challenge with us today. But we don't just want to talk about the difficult times in your career, Wakenda. I want you to take a moment next to tell us about a success story. Can you share one of these moments that has meant a lot to you? And it can be a big victory like a grant or a paper, or even just one of these small wins along the way.
I think in this case, I'm going to pick a small win because, of course, the paper getting accepted and the grant getting accepted are always great. Those feel really good. But sometimes it's those smaller victories that actually make a difference. And I'd say for me recently, we had a lab experiment that was going on, and it had been dragging on for a while. Kind of, we're trying to get this data. We stumbled the first few times with the experimental design in that we didn't get the information we wanted. We felt that something had gone awry. So we kind of had to start back at square one and try again. We were trying to get these cells to do a genetic transformation for us, transgenic mouse model, and it just didn't go as what we were planning it to go. And so I had all these stumbling failures. It took about a year or so. So we kept failing. It was sort of getting frustrating. And I was about to say, well, maybe this isn't going to happen. Maybe we need to give up on this particular aspect of the project and move to something else. And then just as I was feeling that way, one of my co-researchers came to me with this last set of experiments. You got to see what we've done. And it was these beautiful images of cells that we had labeled with a fluorescent label, and the fluorescent label would only be expressed if this particular protein that we were trying to express was going to be expressed. And so it worked beautifully, and these cells lined up just where we wanted them to line up in our model, and it was a beautiful moment. It was like, oh God, it's not all failure. So it took a year or so to get there of failure till you finally got to a point where you're like, oh my gosh, there's a little light shining. And so that was probably for me a really positive moment. It's like, oh, keep going. Even when you get the lulls, get back in there because the highs will come soon.
Definitely. It sounds like you had the most picture perfect results as well, literally there. So that is phenomenal.
Yeah, it was a good moment for us.
Absolutely. So then how do you decide? I mean, you mentioned you were to this point where you were almost going to pull the plug on the project, and then suddenly these great results came in. What are some of the factors that you consider when trying to decide if you should move on after investing a year or so in a project and not getting results?
It is a great question, and I don't know if I have the right answer to it. As a scientist, you can only invest so much time on something before you're going to run out of funding, before you're going to run out of support for it in many other ways. And it's a personal decision. You don't want to invest all of your energy into something that's not going to go anywhere. And if you really feel that the science isn't going to take you there, or the science isn't ready to take you, because that may be the problem, that you're missing that bridge that you need to get to the next step. And it's just not out there yet. Some other scientist has to help invent it for you.
Right. You have to wait for technology to catch up sometimes. Yeah.
Exactly. And sometimes you just have to table things. When that happens, you table it and maybe come back to it in a year or two. But I don't know if there's a right answer. I'm the type that keeps pushing, and I don't know if that's the right thing either, because you do end up with a series of failures and go, well, maybe we're on the wrong track and we have to table this project and let's move to something else. And I'm not sure. I guess it's a gut instinct, whether you move on or you don't move on. But certainly you have to get to some point, even if your gut tells you to keep pushing, if you're really having not the success, put it aside for a year or two and try and come back to it later and see if you have more success with it.
Sure. Well, wonderful to hear about how you strategize in how to work your projects, how to get things moving along. And I think you're absolutely right. You can only have something on the front burner for so long when it's not producing results. You have to kind of shift things around a little bit.
Right.
So thank you for sharing one of these success stories with us today. And I think as a scientist, you stay so busy with the work that you're doing that a lot of things fall along the wayside at different points in your career. And I know one of these things that scientists mention that they often don't have enough time to do is read for fun. So you're often diving in the literature, but you rarely get to escape from the science to enjoy a good book. But can you recommend for us today, Wakenda, one of these books that you've read and really enjoyed so that our listeners and I can add it to my list?
I would say right now, the book that I have on my bedside, which I got to go walk over, which is The People's History of the United States by Howard Zinn. So that's a book I've got on my bedside right now that I'm reading and really enjoying. It's a book of the history of the United States that we don't always get in school. In fact, I certainly didn't get it in my educational training. So it's been really enjoyable. And I've enjoyed it. But you're right. It's hard to find time. I purposely try to make sure every night I get at least 15 minutes of non-scientific reading in before I pass out.
Gotcha. I know. I always try to do that. As soon as I open the book, I seem to fall asleep. So I've taken to the morning train is where I get my reading in. But
that's a good idea.
Fantastic. Well, great recommendation. So are you a history buff yourself?
I do. I like history. I think I tend to like history when it's things we aren't just taught in school, because we're taught sort of this standard rigors of George Washington chopped down a cherry tree, or these little like stories or apple tree along the whatever it is he chopped down along the way that are great, but not necessarily meaty history. I prefer the history that actually influences what happens today. And some of that requires a bit of big digging, but I do love history in general.
Gotcha. And I think you're absolutely right. This is missing from a lot of the training that scientists get, because you have to early on select that you're going to take these science classes instead of the history classes. So
that's right.
Great way to get it through books. Well, phenomenal to hear about what is on your bookshelf these days. And now I want to talk about travel, because I think scientists get so many opportunities to travel, and it's a wonderful aspect of the career that I think a lot of people out there might not realize is part of it. So can you think back now, Wakenda, on all the places that you've been for science, and tell us about your favorite place?
I'm definitely going to have to say Japan for science. And I was there last year for an entire month doing a traveling fellowship through one of our organizations in orthopedics. And it was really an outstanding experience, because I got to present some of my scientific research and some of what I do clinically. And at the same time, I learned a lot from the Japanese orthopedic surgeons that had just as much, if not more, data and science to share back with us.
Well, that sounds phenomenal. So a month in Japan, did that leave you enough time to do a little bit of sightseeing and exploring while you were there?
Definitely. The nice thing is they sort of traveled us around the countryside during this fellowship. So we sort of went to a bunch of different places. And then the last week or so, we were on our own. And so my partner, David, and I just did some leisurely enjoying travel around the countryside. And it's a beautiful country.
Very cool. Did you and David have a favorite place that you saw while you were there?
We were in Nagasaki, and so obviously the atomic bomb museum and everything that's there was very emotional and interesting to see. So I'd say that's probably on the top of the list. But pretty much every city we went to was really beautiful and outstanding. I can't put one above the other.
Right. Can't pick a favorite. That's fair.
Yeah, can't pick a favorite.
Well, this sounds like a wonderful opportunity. So what was one of the highlights then of working with these surgeons on a completely different country, different culture? Were there certain things that really stuck out to you as very different there that what you had experienced in the United States?
Their customs are obviously, not surprising, are different. The way they even do surgeries are a little bit different, and the format of their surgeries. Not that at the end of the day, we're not all ending up doing close to the same thing surgically, but certainly, like I noticed in Japan, they have a little bit more of a hierarchy. There's only one professor allowed at most programs. You can't have more than one, versus here where you may have a faculty group that has 5 professors and 1 department chair or something like that. But they had more of a hierarchy. And so what that does is a lot of people that end up not making it to professor end up going into private practice. And they had a lot more non-operative orthopedic surgeons, which we don't see any of those or very few of those in this country, but they have a huge number of those in their country where they don't do surgical procedures, but they diagnose and treat the non-operative orthopedic conditions. So that was something I learned that was really interesting, I think.
Well, very cool. And this is one of the reasons why I love chatting with scientists about their different experiences when they're traveling, is you pick up on these little cultural differences that you would sort of have otherwise not have any idea about. So wonderful to hear about your experiences, Wakenda. And I think throughout our interview, we've chatted about some of the people who you've interacted with over the course of your scientific career. And I think the people are one of the wonderful aspects of the career. And you get to work with a lot of different groups, whether it's in graduate school, your postdoc days, things like that. And each of them kind of has their own personalities and traditions and fun little quirks that go along with it. So can you think back now on all of these different places that you worked and share with us almost a human story in science that focuses on the people you've worked with and some of the fun memories you shared?
I definitely could give you some shenanigans about my fellow orthopedic residents. I don't know if that's a good story or not.
It's up to you.
I'll give it because we were an interesting group. So when you start a residency program, you join a class of other people who are starting as interns with you, and that you're going to be with those people for the next 5 years throughout your training as resident. And then, of course, most folks go on to do a fellowship these days. And so I had a really good residency class at HSS, my group of people. We actually got into a fair amount of trouble, but one of the things we used to do is we'd get together every once in a while, because as you can imagine, internship was quite a strenuous, difficult experience. And so we actually would plan out a trip once a year where we would go somewhere. And in this particular case, we went to New Jersey. I don't know why we chose New Jersey, but we went to New Jersey and Atlantic City. And we basically spent the weekend racing up and down the beach, contesting each other to a contest, running through casinos because we didn't have any money, so we couldn't really gamble. And
you love running. So yeah, there you go.
We like running. We were just playing tag through the casinos. And that's probably an example of silly stuff that doctors do in their free time, play tag in the casino because we're residents. We don't have money to gamble. So silly stuff like that's what we've done in the past, which was a lot of fun. It's nice to have a group of people that you can laugh with and relax with.
Well, I love this picture that you painted, Wakenda, of you and your group of fellows just going out and having fun together. And I think that's something we really try to emphasize on our program is scientists are people too. You're very invested in your work. You're excited to go in every day. You work really hard, but you're people too. You like to have fun. You have personalities. You enjoy doing things together. So fantastic story. And now we've chatted a little bit about the research you've done and some of the questions that you're trying to answer. But I want to pick your brain today, Wakenda, and hear about one of these big questions that's in your mind that is yet unanswered. So can you share with us if things like funding and staff and technology and feasibility, all these major constraints on science, were not an issue? What is the one question that you would want to answer?
Obviously, my focus is on cancer. I think the key to finding quote unquote cures for cancer or progressing forward with treatment with cancer is going to be our own immune systems. And so we're starting to see that with these new immunotherapies that are coming out that are available for some cancers. But I think that we are going to even blossom with that in so many other ways. When will we be able to create vaccines that actually prevent cancers, that make your immune system ready to start fighting that breast cancer the minute it shows up? And I think that that's the big open box right now is where does the immune system fit into all of this? And when are we going to see that takeoff of scientific data that's eventually going to come around when we start studying this more? So I think that that's a big open question for me. How does our immune system play a role in the treatment of disease and particularly in the treatment of cancer? And I think it's an untapped box that we really haven't looked into much yet.
Well, very interesting question. I myself have not really thought of it. So is this something where you think expertise is lacking, or is it these two fields need to talk to each other a little bit, or what's standing in your way?
I think that they're starting to talk to each other just now. I think that it's coming. So I think you're right. The people that kind of generally do with the immune system, I have not talked to the people that have generally done cancer, right? They tend to be in different towers in the hospital. I think it is going to be a coming together of those groups that we're going to start to see the greatest development going forward. But we've seen that the immune system does play a role in all of this. We just don't understand how and what it's really doing to the full extent. So it's coming, but I think it just needs time for these groups to come together and for the data and the information and the science to start to move in that direction.
Well, this sounds like research that myself and our listeners can look forward to in the future, Wakenda. That's fantastic. So great questions to get our mind turning on this. And I know throughout the interview, we've chatted about these different people you've worked with, as I said, and we've talked about some of the big figures in your life, in your career. And I want to now know, what is the best piece of advice that you've perhaps received from one of these people or from any other colleague or peer along the way?
Let me think, because I've gotten a lot of advice. Maybe one of the best advice things, it's interesting because I'm not sure if anybody's ever given me direct, here's advice. It's more of you learn through observation, you learn through modeling somebody that you think is a good person, and then you model what they do.
Sure.
But I do have to admit, I've had a few colleagues and my professor back at Hopkins that helped steer me in the direction of tumor. One of the things I think he said that has always stuck with me, which is observation goes a long way. You can see a lot of what's going on with a patient, and the same is true about a scientific experiment. If you often just step back and look carefully at what's going on. You don't have to even talk to the person often, not that I'm recommending you don't talk to somebody, but there's so much you can see just by looking at somebody, and it's so true. And so ever since he gave that advice to me, I've always been conscientious to always look at the patient. When they're even first walking down the hallway into the room, they don't even know that I'm looking at them. I can pick out their gait pattern, and that helps with a diagnosis right off the bat. So there's a lot of little things that you can pick up on that help just by looking, just by observing carefully. And I think the same sits over in science. A lot of times you don't see the whole picture because you're so focused on this little tiny experiment, and you sometimes have to step back and take a bigger look at everything. And when you do, you see some really great data or really great information out there that you had not been noticing because you were too focused in on one thing.
Well, I love this emphasis that you have placed on observation. I think that is so key in science. And I think you're so right here that oftentimes when you're working in a very specialized field on a very specific question, you do kind of get tunnel vision. So you miss the big picture a lot of times. So I love this advice to step back and make sure you're taking it all in. So fantastic advice to share with our listeners. Wakenda, is there any other last piece of advice or any last note of inspiration that you would like to end our interview on today?
I guess I would just say, don't give up, always stay focused and keep pushing forward, and definitely find a hobby outside of science that will give you some kind of peace and tranquility, whatever that happens to be: running, basketball, reading a good book, meditating, because I think that helps bring balance to your life. That'd be my advice.
Well, fantastic advice. Listeners, definitely take that advice to heart. And Wakenda, thank you for your time today. Can you tell our listeners how they can reach out if they want to learn more about you and your work?
Probably the best way to reach out would be our University of Rochester Medical Center website, which I believe is www.universityofrochester.org. And I think that would take you to the website. And then you can actually go to our orthopedic department and find me, and also our musculoskeletal research center there. And that will help you tune you into all the research that we're involved in.
Perfect. Well, listeners, definitely take a look in detail at Wakenda's research. And Wakenda, it has been a delight to chat with you today. Thank you for joining us.
Thank you.
Well, it was a pleasure. Listeners, thank you as well for joining us today. We'll see you next time on another episode of People Behind the Science. Your voyage to the lives of today's exceptional scientists has just begun. You can find everything we talked about today, including our guests' favorite books, biographies, photos, and more, when you visit us at www.peoplebehindthescience.com. I look forward to seeing you next time on People Behind the Science.